Why is cancer screening important? The United States Preventive Services Task Force, a nationally recognized group of experts, says that getting the best health care means making smart decisions about preventive services. Preventive services are tests or treatments that your doctor or others provide to prevent illnesses before they cause you symptoms or problems. To help doctors and patients decide together whether a preventive service is right for a person's needs, the task force develops recommendations based on a review of high-quality scientific evidence. For 2 years, her doctor kept reminding her that she needed to have a screening colonoscopy. Denise chose many reasons to procrastinate having a colonoscopy. I was perfectly healthy and had no family history of colon cancer, but basically, out of fear of the test, the prep, and a few dozen lame excuses, I chose to ignore my doctor. It was not until her husband dared her in front of the doctor that she agreed to the test. At the age of 52, Denise was diagnosed with rectal cancer. My fear of colonoscopies was nothing compared to my fear of dying from colorectal cancer. In retrospect, Denise acknowledges that the colonoscopy screen saved her life. I was fortunate. My cancer was in the early stages and surgery offered me a cure. She recalled that the prep for the colonoscopy was not that bad. The colonoscopy was accompanied by sedation that made me wonder, is that all there is to it? The moral of my story, Denise explains, if I had waited until I had symptoms, it would have been too late. It is understandable that certain barriers may exist, including fear of the actual procedure. Talk with your healthcare provider about some of these concerns. Your provider may be able to offer some tips to decrease discomfort and embarrassment. And remember, your long-term health is important to you and the people you love. It's important to talk to your doctor about screening for cancer. The goal of cancer screening is to catch cancer early so that it is easier to treat or cure. This means that even if you don't have symptoms or specific concerns, screening may be recommended. We know talking to your doctor about certain topics can be difficult or uncomfortable. Here are a few questions you can ask your doctor to help you learn more about screening tests. Which screening tests do you recommend for me? And when should I be screened? How should I prepare? Will I have to change my usual schedule or take time off from work? How often do I need to be screened? What happens during the test? Will it be uncomfortable or painful? What are the benefits? What are the risks? Who will do the exam? When will I get the results and from whom? Should someone come with me? Will my insurance cover this procedure? Remember, if you're not comfortable or unable to ask these questions yourself, consider bringing a family member or friend and let them know before the doctor visit your questions, concerns, and what you want from your visit. Here are a few tips to help you prepare to talk to your doctor about what screening tests are right for you and the risks and benefits. Before meeting with your doctor, write down any questions about screening tests that you'd like to talk about. Write down your doctor's answers or ask your doctor if you can record your visit. Taking notes might help you remember your doctor's responses, advice, and instructions. Discuss any family history of cancer. Make sure you understand what the cancer screening and medical tests you are getting are for. Ask every time you don't understand something. Your doctor might use medical language that may be unfamiliar to you. If you're having trouble understanding, say, "I don't understand." When a doctor makes a diagnosis, make sure you understand your condition and fully discuss your treatment options. Prepare a tip sheet with a few specific questions for your provider. Take advantage of the opportunity when your provider asks, "Do you have any other questions or concerns?" Ask your provider for other informational resources or materials, including websites or brochures. To learn more about cancer screening and Tech2Know, please explore www.t2k4health.com. To contact a research team member, please click on the Contact tab at www.t2k4health.com.